underneath their hip, lower abdominal areas just for comfort of the patient. This pill's a little bit squishier than I'd like. I think they all are, but this is not mandatory, but I highly recommend it during practical setup. So we'll start with prone palpations, and then we'll move into side lying. We'll practice move into side lying and then supine. So prone, you are gonna have to have t-shirts removed, towels draped for full exposure of back, lumbar spine. Hopefully you all remembered appropriate clothing and all of that for today. So the first one we're gonna palpate, we talked about these a lot on Wednesday when we were doing our ring meeting. Again, I'm sorry, my hands are freezing cold. Cold hands, warm heart. First we're gonna do, during the Dr. Leva video, she was talking about finding the 12th rib, and she started kind of on the rib cage and moved down. I'm so sorry. You can do that, that's totally fine when she's talking about finding the ribs and then moving down until you find that last rib. I personally like to start in the soft tissue and then work my way superior. It's up to you, whichever way you prefer to do. So for me, I'm gonna start in that soft tissue. That way I know I'm not on any bony structure and I'm not gonna get it confused by miscounting ribs. So starting that soft tissue using that radial side of your index finger, slowly sinking in so that you're not getting a muscular response. And then for finding that 12th rib, I'm then gonna move superiorly until my hands bump into that first rib. Now is that first rib that I'm feeling superiorly, what rib is that? Or what should it be?
12.
The 11th.
11.
Because laterally, it's not gonna be your 12th rib. I mean, everyone's anatomy is a little bit different as far as how far out the 12th rib protrudes, but if you're truly on the lateral sides of the thorax, you're not going to feel the 12th rib. So I'm bumping into that first superior rib, which is gonna be the 11th, and then I'm gonna start palpating posteriorly until I find the lateral edges of the 12th rib, which are actually on that more posterior lateral aspect. And then it's not the most comfortable thing, but I can kind of come around, and feel that distal end of that 12th rib, follow that around, and I'm on that 12th rib. So that would be my one finger confirmation. Good?